Well, the problem with BMI is that, as I often say to people, it's the wrong instrument. It's like using a ruler to weigh somebody. I mean, it's hopeless. It was developed in the mid-19th century by a Belgian polymath called Adolphe Quetelet, and it measures relative weight for height. And the problem with that is that the two most important measures, that is, how much fat do you have and where is it, you learn nothing about those two variables from body mass index. It's a hopeless discriminator of risk.
The body mass index has been used for decades, and although it's very useful to measure obesity, it has got its own deficiencies, particularly that it cannot differentiate between fat mass and muscle mass, and also cannot detect visceral adiposity, i.e. obesity around the waistline, in an effective way. Hence, other approaches need to be considered.
Well, essentially, Innovation Health and Wealth was part of what Sir David Nicholson set up on behalf of the Prime Minister, looking at how do we actually look at all the good things that the NHS does. We're pioneers in so many ways, but actually how do we then prevent people going abroad to try and invest in their technology? How do we encourage them to invest in the NHS? And so Innovation Health and Wealth was the culmination of a big review that was led by Sir Ian Carruthers back in 2011.
First came across BVI in my previous role as the Chief Exec of Medlink West Midlands, an industry support organisation. We helped Select Research look at how they could develop the product and how they could get the product into the NHS.
I was involved in the early work with the body volume index when I was a junior researcher helping Dr. Asad Rahim, who was conducting this work at Birmingham Heartlands Hospital. The body volume index is quite an innovative thought and innovative approach to measure people adiposity. We know that obesity is a major risk factor for many health conditions, including type 2 diabetes, as well as it's a major, and fighting the obesity and type 2 diabetes epidemics are of major political interest.
We know that basically best practice isn't always adopted at pace and scale. NHS is pretty broke, so we've got to try and create its contribution to UK PLC. We know that when we've had conversations with medtech and pharma sectors and so on, that they've actually been going elsewhere because they're easier to do business with other people than it is typically with the NHS. So we worked with a number of people to look at what needs to happen. We had lots of responses, various steering groups and advisory groups, and there's a long list of actions that were pulled together.
The body volume index, particularly using it via an app, is very easy to use, is reproducible, and it has been shown to correlate very well with body mass index, waist circumference measurements, as well as body volume measurements using PodPod. We have shown previously here in Heartlands, in a small trial, that using the body volume index on top of lifestyle changes might actually promote further weight loss. And we have seen many patients are interested in watching how their body volume changes as time goes by while implementing lifestyle changes. And these aspects cannot usually be captured easily or measured easily using the body mass index.
About 50% of patients who are classified as obese will actually have a normal life expectancy. So you can see that there's a problem here with the using a measure of relative weight for height as a measure of risk.
Making the BVI as an app is really useful because patients can have it done as part of their routine care when they come into the clinic. In addition to having their blood pressure and weight measured, they can have also their body volume index measured, because all the nurses' clinics have got computers and they can have the app downloaded to it, and that will make it very easy to measure BVI in real clinical life.
A key action was, though, about how do we create the situation where best practice can be shared, where we have compliance with NICE guidance, where we can encourage small, medium-sized enterprises to actually get involved with the NHS early doors as opposed to much further down the line. And, of course, a lot of the Innovation Health and Wealth targets have actually been aligned to the Sequin payments as well.
And obviously in my new role in the Academic Health Science Network, we're very interested in looking at how we can help and support the development of the app and also the adoption of the app into the NHS.
If Public Health England decides to support the use of body volume index, we certainly will be delighted to continue the work which we started 7 years ago or 8 years ago in that regard, and support research to further validate and prove the efficacy of using body volume measurements as a strategy to aid weight loss as well as prevent diabetes.
There are only two things you need to know about body fat. How much is there and where is it? And the problem with body mass index is it tells you nothing about either. And that's really important, because what is important is the distribution of that fat, because it is the distribution of the fat which leads to the metabolic risk with patients. So there are plenty of patients, and I see them all the time, who are classified as obese, but who have no metabolic compensation at all. And these patients may well have a normal life expectancy. Equally well, there are people within the so-called normal BMI range who are dysmetabolic and at increased risk. So that's why most experts in the field now think the body mass index has long passed its sell-by date.